All right, so today let's talk about something you may have heard about: adrenal insufficiency.
Yeah.
You know, Addison's disease, right?
Right.
Where your adrenal glands, they just don't produce enough cortisol.
You got it. But Addison's disease is just one type.
Oh, really?
There's actually two other types that are out there and often get mistaken for other things like chronic fatigue or even fibromyalgia.
So 3 types total.
Exactly.
And that's what we're going to unpack today.
Yes.
We're calling this Deep Dive Beyond Addison's, and we'll be focusing on secondary and tertiary adrenal insufficiency.
We're going to be pulling some really interesting information from the up-to-date article called Causes of Secondary and Tertiary Adrenal Insufficiency in Adults.
Okay.
And you might be surprised by some of these causes.
I'm ready.
Yeah.
So let's start with secondary adrenal insufficiency.
Okay.
Now, this all revolves around the pituitary gland, am I right?
You are.
This tiny little conductor of our hormonal orchestra.
The pituitary is essential, and when it's not producing enough ACTH, yeah, that's the hormone that tells your adrenal glands to produce cortisol.
Right.
Well, things can go downhill fast.
Yeah, like what happens?
You start seeing fatigue, low blood pressure, and just a whole host of other issues.
So what causes this issue with the pituitary gland?
Well, there's a pretty wide range, actually.
Oh, wow.
It can be anything from pituitary tumors to very rare genetic defects.
Okay.
There's even a mutation in the POMC gene that can lead to secondary adrenal insufficiency.
Hold on, the POMC gene.
Yeah.
Isn't that the one they're always talking about with obesity and red hair?
That's the one.
Wow.
So the POMC gene is actually responsible for producing a protein that's involved in pigmentation and also appetite regulation.
Oh, wow.
So when it's mutated, it can have this cascade of effects.
Wow.
From your hair color to your adrenal function.
It's all connected.
Yeah, it really shows how intricate our genes and hormones are and how one tiny little change can completely throw the whole system off.
That's crazy, and it really makes you realize how much we don't know about the body. So we've got the pituitary problems.
Right.
But then there's also something called isolated ACTH deficiency.
Right.
What is that?
It's a rarer form.
Okay.
But essentially, think of it as a targeted attack on the cells that produce ACTH
Okay.
while leaving other pituitary hormones relatively untouched.
Okay, so it's much more specific.
Yeah, it's rarer than the other forms of secondary adrenal insufficiency, but researchers believe that it might be autoimmune in nature.
So like the body's attacking itself.
In a way, yes. And here's something that might surprise you.
Okay.
Isolated ACTH deficiency is sometimes associated with alopecia areata.
Alopecia areata.
Yeah, which is patchy hair loss.
Okay.
And even memory problems.
Wow.
So this points to a possible shared autoimmune target between the brain hair follicles and the adrenal glands.
Interesting. So we've got pituitary problems, potential autoimmune attacks. What about just things in everyday life?
Yeah.
Are there things that we might be doing or medications that we're taking that could be messing with our adrenal glands?
You might be surprised to hear that medications, even common ones, can actually be the culprit behind secondary adrenal insufficiency.
Okay.
For example, high-dose progestins.
The progestins.
Yeah.
Those are used for appetite stimulation in cancer patients and to treat breast cancer.
That's right, because they mimic some of cortisol's effects.
Exactly.
But if you withdraw them suddenly, it can actually trigger adrenal insufficiency.
Oh, why?
So this is something to keep in mind if you or anyone you know is taking high-dose progestins.
So it's almost like the body gets used to having that extra cortisol and then freaks out when it's gone.
Yeah, that's a good way to put it.
And it's not just progestins, right?
Right, opiates can have a similar impact.
Opiates?
Yeah.
Really? I would have never thought of that.
Yeah, they can actually disrupt your natural cortisol rhythm and in some cases can even lead to adrenal insufficiency.
So something as common as pain meds could be impacting my adrenal glands.
That's why it's important to monitor patients who are taking opiates long term.
Wow, that's definitely something I'll be asking my doctor about.
Good.
So we've covered secondary adrenal insufficiency.
Right.
But you mentioned there's also something called tertiary adrenal insufficiency.
Yes.
So what's the difference?
So in tertiary adrenal insufficiency, the problem isn't the pituitary gland itself,
Okay.
but the hypothalamus.
The hypothalamus.
Yes, that's the area of the brain that controls the pituitary gland.
So it's like the control center for the control center.
Right. It's very important. And one of the most common causes of this type of adrenal insufficiency is abruptly stopping long-term high-dose steroid treatment.
That's why doctors always stress the importance of tapering off steroids.
Exactly. It gives the hypothalamus time to adjust.
Okay.
Now, another cause of tertiary adrenal insufficiency is actually curing Cushing's syndrome.
Wait, what?
Yeah.
How can curing something cause a problem?
So in Cushing's syndrome, you have really high levels of cortisol
Right.
when you bring those levels back to normal. Sometimes the body has difficulty adapting because it's been in overdrive for so long.
So like a rebound effect almost.
You could say that, and here's something else to keep in mind.
What's that?
Even those cortisone shots that people get for joint pain,
Yeah.
they can contribute to adrenal suppression if they're not managed carefully.
Oh, wow. So many different things can impact this.
Yeah.
Okay, so to recap, we have secondary adrenal insufficiency, which is a pituitary problem,
Right.
and then tertiary, which is a hypothalamus problem.
Exactly.
What's the big takeaway here for our listeners?
The big takeaway is that both secondary and tertiary adrenal insufficiency are complex, and they can often go undiagnosed.
Why is that?
Well, they can mimic so many other conditions, which
Okay.
can lead to delays in treatment.
And that's where this deep dive comes in.
Right.
It's giving us the information to spot these red flags
Exactly.
and to ask the right questions.
If you've been experiencing things like fatigue weakness, low blood pressure, or even cognitive issues that haven't been explained, it's definitely worth bringing up adrenal insufficiency with your doctor.
Especially if you have any of the risk factors we've talked about.
Exactly.
Like previous steroid use, pituitary issues, or certain medications.
Right. It's all connected.
We've talked a lot about the causes.
Yeah.
But what about the actual experience of living with these conditions?
Yeah.
What does that feel like?
That's a really good point. You know, it's one thing to understand why it happens, but how it affects people is just as important.
Absolutely.
Imagine feeling constantly exhausted and weak,
Yeah.
or having difficulty thinking clearly, and it gets misdiagnosed as something else.
Right.
It can be incredibly frustrating.
For sure.
And really debilitating.
It really shows how important awareness and accurate diagnosis are.
Absolutely.
Okay, so we focus a lot on the causes. But what are the symptoms that people should actually be looking out for? What are some of the signs that something might be off with the adrenal glands?
That's a great question, and it's the perfect lead-in to the next part of our discussion.
Okay.
We're going to dive into the nitty-gritty of symptoms.
Awesome. I'm ready.
Okay, so one of the tricky things about secondary and tertiary adrenal insufficiency is that they can be master mimics.
Mimics?
Yeah, their symptoms are usually very general,
Right.
and they can overlap with so many other conditions.
So they're often misdiagnosed.
Exactly.
What are we talking about here?
What kind of symptoms should people be aware of? Well, some common red flags include things like fatigue,
Fatigue.
muscle weakness, loss of appetite, and unintentional weight loss.
Those all sound pretty vague.
Yeah.
I mean, who hasn't felt tired or lost their appetite at some point?
You're right, they are common experiences, but we're talking about persistent fatigue and weakness.
Oh, okay.
That just doesn't go away with rest.
Got it.
And the weight loss we're talking about is unintentional,
Unintentional.
meaning you're not actively trying to lose weight, but the weight just seems to be melting off.
So it's more about the persistence of these symptoms and not having a clear explanation.
Exactly.
Okay, so are there any other symptoms that might point to these types of adrenal insufficiency?
Well, some people also experience things like nausea and vomiting,
Oh, wow.
abdominal pain, and even low blood pressure.
Okay.
This can lead to things like dizziness or even fainting.
Oh, so a lot of digestive issues and feeling faint.
Yeah.
Doesn't sound fun.
Not at all.
Are there any mental or emotional changes associated with adrenal insufficiency?
Yeah, absolutely.
So beyond the fatigue and weakness?
Some people report things like mood swings, irritability, feelings of depression.
Okay.
Difficulty concentrating or remembering things is also really common.
Wow. So it really can affect you physically and mentally.
You really can.
It's amazing how connected everything is.
It is.
So you mentioned that these conditions could be difficult to diagnose.
They can.
Is it just because the symptoms are so general?
Well, that's part of it. The symptoms are so general that they often get attributed to things like stress,
Shrimp.
lifestyle factors, or even other underlying medical conditions.
Okay.
Another challenge is that the standard blood tests for cortisol levels don't always pick up on secondary or tertiary adrenal insufficiency.
So how do you accurately diagnose these conditions?
It often requires more specialized testing, like the ACTH stimulation test.
The ACTH stimulation test.
Yeah.
What is that?
It's actually a pretty straightforward test.
Okay.
They inject a synthetic version of ACTH.
ICDA.
Yeah, the hormone that stimulates the adrenal glands to produce cortisol,
Right.
and then they measure how much cortisol your body produces in response.
Okay.
So if your cortisol levels don't rise like they should after the injection, it suggests that there's an issue with the adrenal glands themselves or the pituitary gland's ability to communicate with the adrenal glands.
So it's a way to pinpoint whether the problem is at the source, the adrenal glands,
Yes.
or with the messaging system.
Exactly, and depending on the results of that test, further testing might be needed to figure out the root cause.
So it sounds like a bit of detective work,
It is,
piecing together all the clues.
to figure out what's going on.
So let's say you go through all of that and you finally get a diagnosis.
Right.
What happens next?
What's the treatment? Well, the good news is that once you have a diagnosis, these conditions are usually manageable with hormone replacement therapy.
Okay, so you're basically replacing the hormones that the body isn't producing enough of.
Exactly.
Okay.
The most common treatment is to take synthetic cortisol,
Okay.
like hydrocortisone or prednisone.
And that brings the cortisol levels back up to a normal range.
Exactly.
And that helps with all those awful symptoms we were talking about.
It does.
The fatigue, the weakness,
Okay.
mental fog.
Yeah, in many cases, hormone replacement therapy can significantly improve energy levels, mood concentration, and overall quality of life.
That's amazing.
It really can be life-changing for people who have been struggling.
That's awesome. It's incredible what modern medicine can do.
It is.
Is this hormone replacement a lifelong thing?
That's a great question.
Or is there a chance that you could eventually stop treatment?
In some cases, if the underlying cause of the adrenal insufficiency is treatable,
Okay.
you might be able to wean off of the hormone replacement therapy.
So, for example, if it's a medication side effect and you stop taking that medication,
Right.
your body might start producing enough cortisol again.
Exactly. Or if it's caused by a pituitary tumor that can be removed or treated with medication, you might be able to stop the hormone replacement therapy.
Okay.
But in many cases, it is a long-term management strategy.
Especially if the damage is permanent.
Right. And that's why it's so important to work closely with your doctor.
Yes.
Not just to get the diagnosis, but to monitor your hormone levels and make sure that you're getting the right dose of medication.
Sounds like a personalized approach is key.
Absolutely.
Are there any other factors that influence the dosage?
Yeah. Something important to remember is that the dosage might need to be adjusted over time, especially during periods of stress or illness.
That makes sense.
When you're under stress, your body naturally produces more cortisol.
It's like a built-in resilience mechanism.
Exactly. But if you have adrenal insufficiency, your body can't do that.
Oh, right.
So you might need a higher dose of medication during those times.
Good.
It's all about fine-tuning the treatment
To meet the individual's needs.
to make sure their body has the support it needs.
Okay.
Now, while hormone replacement therapy is effective at managing the symptoms, it's important to remember that it's not a cure.
Right.
It's treating the symptoms, but it's not addressing the underlying cause.
Like putting a Band-Aid on it.
Yeah, that's a good way to put it.
You feel better, but you still have the underlying problem.
Exactly. So ongoing monitoring is essential.
Being proactive is key.
Absolutely.
Okay, so we've learned a lot about secondary and tertiary adrenal insufficiency. But I'm curious to know more about how this condition affects our overall health.
Okay.
What are some of the long-term consequences we should be aware of?
Okay, well, that's an important question and a perfect segue into the next part of our discussion.
I'm ready.
So one of the key things to understand is that adrenal insufficiency can make you more susceptible to other health problems.
So it's not just the direct effects of low cortisol,
Right.
but it creates a domino effect that can trigger other issues.
Exactly. So for instance, people with adrenal insufficiency are often more vulnerable to infections.
Infections?
Yes.
Why is that?
Well, cortisol helps to regulate our immune system.
Right.
And when cortisol levels are low, the immune system can become overactive or underactive,
Okay.
which makes the body more vulnerable to infections.
It's like having a weakened defense system.
Yeah, it makes it harder to fight off those bugs and viruses.
And it's not just infections.
Right. Adrenal insufficiency can also impact your blood sugar control, which can make it more challenging to manage diabetes.
So it really complicates things for people who are already dealing with a chronic illness.
Yes. And we can't forget about bone health.
Bone health.
Yeah. Adrenal insufficiency has been linked to an increased risk of osteoporosis.
Which weakens the bones and makes them more prone to fractures.
Exactly.
This is painting a pretty serious picture.
It is.
It really highlights why early diagnosis and proper management are so important.
I agree. And it really speaks to the need for a holistic approach to healthcare.
Thinking about all the systems in the body and how they're connected.
Exactly.
So we've talked about these increased risks.
Right.
Are there any other long-term implications we should be aware of?
There is one that's especially important for women.
Okay, what's that?
Adrenal insufficiency can impact fertility and pregnancy.
Really? I never would have thought of that.
Yeah, it often gets overlooked, but remember, cortisol plays a role in many different hormonal processes,
Right.
including those related to reproduction. So if your cortisol levels are off, it can disrupt the hormonal balance needed for conception and a healthy pregnancy.
It's amazing how one hormone can affect so many different things.
It is.
So if a woman with adrenal insufficiency does get pregnant, are there special considerations?
It becomes even more important to work closely with your doctor.
Okay.
You need careful monitoring of those hormone levels.
Okay.
You may need to adjust medication dosages throughout the pregnancy.
Because everything changes so much during pregnancy.
It does. It's a constant state of change.
Right.
And it's about making sure that both the mother and the baby are getting the right amount of cortisol.
Okay.
Too little or too much can have serious consequences.
This really highlights the need for individualized care and open communication with your doctor. You
Absolutely.
need to advocate for yourself and find the right experts.
I agree.
This has been such a great deep dive so far.
It has. We've covered a lot.
Yes, we've gone from the basics of secondary and tertiary adrenal insufficiency
Right.
all the way to the bigger picture, to how it impacts our health and well-being.
It's been a fascinating discussion.
It really has.
I think the biggest takeaway for listeners is that even though adrenal insufficiency is often hidden and misunderstood,
Yeah,
it's a serious condition and it shouldn't be ignored.
absolutely.
Knowledge is power.
Yes.
And by understanding these conditions, we can empower ourselves to get the right care, manage our symptoms, and live our best lives.
Exactly.
Couldn't have said it better myself. That's a great question, and it's the perfect lead-in to talking about symptoms.
Okay.
But one of the tricky things is that they can be master mimics.
Mimics, what do you mean?
Well, the symptoms, they can be very general,
Okay.
and they often overlap with a lot of other conditions.
So it's easy to misdiagnose them.
Exactly.
So what are we talking about here? What kind of symptoms?
Yeah, what should people be watching out for? So some common ones are fatigue,
Okay.
muscle weakness,
Uh-huh.
loss of appetite,
Okay.
and unintentional weight loss.
Those are pretty vague.
Yeah.
I mean, everyone feels tired sometimes or loses their appetite.
True, but we're talking about persistent fatigue and weakness.
Okay.
That doesn't get better with rest.
Okay, so it's different.
Yeah, and the weight loss isn't intentional.
Okay.
It's not like you're dieting. The
Okay.
weight just comes off.
So it's more about how long it lasts and not really knowing why it's happening.
Exactly.
What about other symptoms? Anything more specific?
Yeah, some people experience nausea and vomiting,
Oh, God.
abdominal pain,
Okay.
and even low blood pressure, which can make you busy or even faint.
So digestive problems and feeling lightheaded?
Yeah.
Not good.
Not fun.
What about mental or emotional changes? Anything like that?
Yeah, for sure.
Beyond just feeling tired?
Some people experience mood swings, irritability,
Okay.
even depression, and trouble concentrating or remembering things.
Wow. So it really affects your whole body and mind.
It can.
It's amazing how it's all connected.
It is.
You mentioned before that it can be hard to diagnose. Is that just because the symptoms are so common?
Well, that's part of it.
Okay.
They're so general that they get blamed on stress or lifestyle
Right.
or other medical problems.
Okay.
And the standard blood tests for cortisol, they don't always catch secondary or tertiary adrenal insufficiency.
Oh, so how do you diagnose it then?
It often requires a more specialized test called the ACTH stimulation test.
The ACTH stimulation test? What is that?
Well, they basically give you a shot of synthetic ACTH,
Okay.
which is the hormone that tells your adrenal glands to make cortisol,
Right.
and then they see how much cortisol your body produces.
So they're giving the system a boost and seeing how it reacts.
Exactly.
Okay.
And if the cortisol doesn't go up enough,
Yeah.
then it means there's a problem with either the adrenal glands themselves or the pituitary gland isn't communicating with them properly.
So it helps figure out where the problem is.
Yeah, is it the adrenal glands or is
Okay.
it the messaging system?
Okay, and then you might need more tests.
You might, depending on the results, we might need to do scans to check for tumors
Okay.
or even genetic testing.
Wow, so it really is like detective work.
It can be
Trying to put all the pieces together.
to figure out what's going on.
So let's say you get a diagnosis.
Okay.
What's next? What's the treatment?
Well, the good news is that it's usually manageable with hormone replacement therapy.
So you replace the hormones that the body isn't making.
Exactly.
Okay.
The most common treatment is taking synthetic cortisol.
Like hydrocortisone.
hydrocortisone or prednisone.
Yeah.
Yeah, and that helps bring the cortisol levels back to normal.
And this helps with those symptoms we talked about.
It does.
The fatigue, the weakness,
Yep.
brain fog.
In many cases, it can drastically improve those things.
Really?
Energy levels, mood focus, quality of life.
That's incredible.
Yeah, it can really make a difference.
It's amazing what medicine can do.
It is.
So is this a lifelong thing, the hormone replacement?
That's a good question.
Or can you eventually stop taking it?
It depends. Sometimes, if you can treat the root cause,
Yeah.
you might be able to wean off the medication.
Okay, so like if it's a side effect of another medication and you stop taking that one?
Exactly. Or if it's caused by a certain type of pituitary tumor that can be removed or treated,
Okay.
then you might not need the hormone replacement anymore.
But a lot of times it's long term.
It can be, especially if the damage is permanent.
So you really need to work with your doctor.
Absolutely.
Not just to get diagnosed,
Right.
but to keep track of your hormones and make sure you're getting the right dose.
It's about finding the right treatment for each person.
Personalized care.
Exactly.
Are there any other things that affect the dosage?
Well, the dosage might need to change over time,
Okay.
especially during times of stress or illness.
That makes sense because when you're stressed, your body makes more cortisol.
It does. It's like a natural defense mechanism.
Right.
But if you have adrenal insufficiency, your body can't do that.
Oh, right.
So you might need more medication during those times.
So it's all about fine-tuning the treatment
It
to fit your individual needs.
And making sure your body has the support it needs.
Okay, so hormone replacement therapy helps with symptoms,
Yeah.
but it doesn't cure it.
Right. It manages the symptoms, but it doesn't fix the underlying cause.
So it's kind of like putting a Band-Aid on a cut.
That's a good analogy.
It helps, but the problem's still there.
Right. So you need to be monitored for any changes.
Stay proactive.
Absolutely.
We've learned so much.
We have.
But I want to know more about how this affects our overall health.
Okay.
What are the long-term consequences?
Well, that's a great question and a perfect way to lead into the next part of our conversation. Okay, so one of the key things to remember is that adrenal insufficiency can actually make you more susceptible to other health problems.
So it's not just the low cortisol we need to worry about.
No, it can actually trigger other issues.
Like what?
Well, for example, people with adrenal insufficiency are more vulnerable to infections
Really? Why is that?
because cortisol plays a role in regulating our immune system.
Oh, right.
So when it's low, your immune system can be overactive or underactive.
Right.
And that makes you more likely to get sick.
So it's like your defenses are down.
Exactly.
Yeah.
It's harder to fight off those bugs.
And it's not just infections, right?
No, adrenal insufficiency can also affect blood sugar control,
Okay.
which can make it harder to manage diabetes.
That's a big deal, especially for people already dealing with a chronic illness.
Exactly. And we can't forget about bone health.
Bone health, too.
Yeah. Adrenal insufficiency has been linked to osteoporosis.
Osteoporosis, that's the one that weakens your bones, right?
Yes, it makes them more prone to fractures.
This is all sounding pretty serious.
It is.
It really makes you realize how important early diagnosis and treatment are.
I agree, and it really highlights the need for a more holistic approach to healthcare.
Absolutely. You can't just look at one thing in isolation.
Right? Everything is connected.
So we've talked about these increased risks.
Yeah.
Are there any other long-term consequences we should be thinking about?
There's one that's particularly important for women.
Okay, what's that?
Adrenal insufficiency can affect fertility and pregnancy.
Really? I would never have guessed that.
Yeah, it's often overlooked.
Wow.
But remember, cortisol is involved in so many hormonal processes,
Right.
including reproduction.
Okay.
So if your cortisol is out of whack, it can really mess with the balance you need to get pregnant and have a healthy pregnancy.
Wow. It's incredible how one hormone can have such a big impact.
It really is.
So if a woman with adrenal insufficiency does get pregnant, what happens then?
It's even more important to work closely with your doctor.
Okay.
They'll need to monitor your hormone levels very carefully.
Yeah.
And they may need to adjust your medication throughout the pregnancy.
Because everything is constantly changing during pregnancy.
Exactly. It's all about making sure both mom and baby are getting the right amount of cortisol.
Not too much, not too little.
Right.
This really highlights the importance of finding a doctor you trust
Absolutely.
and being your own advocate.
Yes.
This has been such an eye-opening deep dive.
We have.
We've gone from the basics of secondary and tertiary adrenal insufficiency
Right.
all the way to how it affects our overall health and well-being.
It's been a fascinating discussion.
It really has, and I think the biggest takeaway for our listeners is that adrenal insufficiency is serious,
It is.
even though it's often hidden and misunderstood.
It shouldn't be ignored.
Absolutely. Knowledge is power.
It is.
And the more we understand about these conditions,
Yes.
the better equipped we are to take care of ourselves.
Exactly. We can get the right treatment, manage our symptoms, and live full lives.
Couldn't have said it better myself. Well, that brings us to the end of our deep dive on adrenal insufficiency.
I hope you found it informative
We did.
and empowering.
Absolutely. Thank you for joining us.
Until next time, stay curious, stay informed, and stay well.